little bit of a homecoming today. We're visiting with Jason Nickisch, Dr. Jason Nickisch, a pharmacy clinical manager at Providence Health and Services here in Western Montana. Now, you had a roundabout way of getting to Missoula, right? You actually started out in Forsyth, right?
Yes, originally from Forsyth, and that's where I grew up before coming to University of Montana and completing pharmacy school here back in 2002.
All right, and then you went where?
From there, I did some postgraduate training at Denver Children's in Denver, Colorado, and then came back and worked 8 years for Benefice in Great Falls. And then I was most recently down in Odessa, Texas for 2 years.
Lured to Texas, is that it?
Lured to Texas, yes. I was completing my MBA through the distance learning program at UM and started to get some management experience, or wanted to get some management experience as I finished that program. So went down to Texas for 2 years as assistant director of pharmacy, and then made my way back up to Missoula, which is great.
Oh yeah, because you come live where it's flat and hot. Okay, no mountains, but good work experience.
Absolutely, great work experience, but great to be back in Montana.
Tell me how'd you get the gig here at Providence St. Patrick Hospital?
Well, this job came open last December, and so that management experience that I've received, and then the MBA, finished that program in May of this year. So with all of that experience, gave me the opportunity to get into this role and take over the management position here.
Well, welcome back.
Thank you very much.
Good to have you back in Missoula. Now, let's talk. I bet a lot of folks out there, Jason, don't realize that Providence St. Patrick Hospital has its own in-house pharmacy. Now, that may come as a surprise to some, but tell us about it. What's it like? Where is it located, and what's it like?
No, absolutely. The inpatient pharmacy is kind of a background function in the hospital for sure. So it's not one of those frontline experiences that you get to see every day as a patient. But we are located on the first floor of the St. Patrick Hospital, and our services are basically to prepare medications, sterile products, but also everything goes out of the pharmacy as a single dose in the hospital. So we have to repackage and do a lot of preparation to get those medications out to the patients in the safest manner possible. So a lot of time and effort's dedicated to that.
Well, I know that you have usually have well over 100 people in the census in the hospital. So most of those people at one time or another are going to need some sort of prescription medication. So you guys must be on your toes all the time.
Oh, absolutely, yeah. Pretty much every patient that comes into the hospital is going to require some medication. And so we're definitely touching every patient that comes into the facility and have some level of interaction with them, whether that's direct face-to-face or just providing that medication as a background service in the hospital.
So how does that work? I mean, do the doctors or the nurse? Well, the doctors obviously prescribe the medication, and who actually, just give me the mechanics of how it gets from them to you and then back to the patient again.
Okay. Yeah. The main process for that is that the provider, the doctor, will enter that medication order into our electronic system. That order all orders have to come through pharmacy. All medication orders have to come through pharmacy to be verified before we can send it out of the pharmacy outside of emergent situations. So it'll come to a pharmacist into our electronic queue. We'll verify that order. Once it's verified, it'll actually send out a label for our pharmacy technicians to fill, or it will send a message to one of our electronic dispensing machines up on the floor, and then the nurses can actually access that medication once it's been verified, and it essentially releases that medication for them to pull for that patient.
So nobody has to keep running up and down the stairs to get the medication, although that's good exercise. But
yes, we do a little bit of that from the running perspective, but we do rely a lot on technology to make that process a little bit easier.
All right. How is your pharmacy different from, say, like the big box and the other independent pharmacies around town? What sets you guys apart from all the others?
Well, I'd say that hospital pharmacy is very different from one of the big box stores, and a lot of their interactions are that direct face-to-face customer interaction as patients are coming in to pick up their prescriptions. And for us, most of our services do run in the background. Although we do have pharmacists that are up on all of the units, we actually have pharmacists dedicated to each unit in the hospital. And so we do participate in the team rounding experiences throughout the hospital and provide recommendations and manage medications with the providers, with the nurses, as a part of our service line as well. But for the most part, we're dealing more directly with the healthcare providers as opposed to the direct patient interaction, although we do have some areas that we do that as well.
Now, there's one thing I think people need to know. The assumption may be, gosh, if I get my prescription filled at the hospital, it may cost more. But that's not true, is it? You guys actually have a price matching program.
Yes, at the end, I guess we have two segments of the pharmacy at the hospital. We have the inpatient, which I'm most directly related with, but we do have the Broadway pharmacy on the main floor of the hospital as well, and they do offer outpatient prescription services, and that's under different management, but yes, very competitive and a good option for patients, especially as they're leaving the hospital to get those prescriptions filled as they're heading home.
Great. Well, we're going to take a little break, come right back. We have all three lines open. If you have a question for Jason Nickisch, he's the Pharmacy Clinical Manager at Providence Health and Services, Western Montana. This is Health Talk, and we'd love to have you have a question or a comment. Give us a call at 721-1290. Happy to pass that along to Jason. We'll be right back. We're back on Talk Back. This is Health Talk, of course, sponsored by Providence Health and Services, Western Montana. Jason Nickisch joining us here in studio. He's Pharmacy Clinical Manager at Providence Health and Services right here in Missoula. Now, one of the things that John brought up a second ago was the fact that you and your staff have to be really, I mean, quite literally on the cutting edge of what's happening with prescription medications because they're changing and improving and being revised, so rapidly, right?
Absolutely. I mean, that's a huge portion of the pharmacist's job is to bring that expertise and that medication expertise to the healthcare team because it is such a large segment of medications that you have to keep on track of for different specialties across the board. And so we need to dedicate pharmacy services in all of those areas, whether that be critical care or cardiac services, oncology, whatever it may be, to be assured that we can provide that expertise and essentially consultative services to the providers, whether that be physicians, nurse practitioners, in making the best medication decisions.
Are there some areas of healthcare that are really exploding as far as new pharmaceutical things, things to help the patient get better faster with fewer side effects, things like that? Anything that you can point to that think of that, hey, they just came in, we're really excited about this?
I think the biggest area over the past couple of years for specialty products is targeting very specific populations. And oncology or cancer type medications are very big, and there's a lot of those in the pipeline right now to try to minimize adverse effects because typically they have some very severe adverse effects associated with them. So there's a lot of research and development in that area to provide better products and to help keep patients healthier without having so much of the adverse outcomes that they've had with past products. But many, many other specialty products geared towards specific disease states, whether that be cystic fibrosis, multiple sclerosis, those types of things are becoming more and more prevalent out in the marketplace.
And I'm sure that one of the things that all the physicians and nurses and health practitioners to know what to do is to make sure the patient knows very clearly when they give a prescription, there's some, this is going to make you better, but there may be some side effects, right?
Yes, absolutely. That is a huge piece, and that's a huge piece of the pharmacy job as well. That information is given to that patient up front as that's being prescribed by the doctor, but that's pharmacy's background as well as that resource to be able to reiterate those adverse effects, but also to be that resource as that patient gets home and they start experiencing some of those side effects. They can call in and ask us, is that something that's associated with the medication, something I should be worried about? And that's the resource that we want to be able to provide from the pharmacy side of things.
And that's really an ongoing relationship, isn't it?
Yes, absolutely. And that's whether that be in the hospital or out in the community at the community pharmacies, we're out there as a profession providing that resource and providing that expertise, not just to the providers, but to the patients as well.
Now, do some of the other folks at the local pharmacies, do they come to you and ask about some of the new cutting edge things? Because you're right there. I mean, you guys are right there at basically the cutting edge of what's happening.
I think that we do come together from an educational perspective. A lot of the educational offerings that are offered throughout the state or locally are coordinated efforts between both community and hospital type settings. But it's such a different mix of the medications that you're going to be focused on. Whereas in the hospital, we're dealing with much more acute type situations typically, that a lot of those medications you don't see out in community practice. And so there is a pretty big difference between the two practice settings, but we do try to collaborate as much as possible.
You just brought up education, which is big, because right here at the University of Montana, you had said you graduated from the pharmacy program. Fantastic pharmacy program. I have several friends of my family that have graduated from there and moved on, are now working all over the country and being very, very successful. What's the relationship between what you folks do and the University of Montana?
Well, for St. Patrick's, we have a large contingent of pharmacy students that come through every year. We probably have between 20 and 30 students that actually come through and that we provide rotations for at the hospital. So to give them a little bit of experience and practical experience as to what it means to be a hospital pharmacist. So they'll come in and either do 8-week rotations or they'll do 4-week rotations in specialty areas. And it just helps them determine where they want to bring themselves in the future and what they want to focus on.
When they come in to your program as students, where are they at in their educational experience? I mean, are they at their first year, second year? Are they about ready to launch into their own careers, or is it the beginning, middle, or end, or kind of a mixture?
I'd say the vast majority, that 20 to 30 students I was talking about, are in their last year of pharmacy education. And so they're really gearing up to go out into the workforce and trying to gain that last year of practical experience before getting out there. But we also do have an intern program that we actually hire University of Montana students, and they actually work for us throughout their entire pharmacy program and work with us in the pharmacy in different aspects. And that's tailored to grow over that 3 years based off of the education they're receiving on a year-to-year basis.
Now, do these folks in the pharmacy program obviously realize that continuing education is a way of life for them, right?
Yes. Well, a lot of it's mandated by law that we do have education requirements that we must meet, but it's any healthcare profession. There's so much to keep up on a year-to-year basis that if you're not dedicated to that education on an ongoing basis, you fall behind so quick. And
Well, John says we have a Facebook question, so go ahead, John.
Yeah, this is from Katie. She wants to know, how many pharmacists work there? How many compounding pharmacists? How many pharm techs? And I might add an extra question. What do these different jobs do?
Okay. Yeah, we have about 26 total pharmacists, and there's a mix between full-time, part-time. But as far as bodies, we have about 26 pharmacists in the pharmacy department, about half as many technicians that work there. And from compounding services, we don't necessarily do the traditional type of compounding, but we do IV sterile product preparation, and we do a lot of that from the inpatient pharmacy. As far as the different roles, the pharmacists are the ones that are responsible for verifying all the medication orders, and they're also responsible for being a part of that team-based healthcare and participating with the providers. Technicians are serving in a support role, and so they are actually doing a lot of the repackaging, a lot of the dispensing, some of the running that we were talking about earlier, filling the—
They're young, make them run.
filling the dispensing machines up on the floors. They're really into that preparation and distributive type service. But we do have one area of technicians that they actually do help us with collecting home medication lists. So we try to update every patient's medication list when they come into the hospital to make sure that it's as accurate as possible and that we have the right information to make decisions on.
Now, is that part of the, I know the updated medical transcription, medical records, electronic medical records, you guys obviously are a big part of that, right?
Yes, absolutely. And that's where it starts, is from the intake of the patient into the system, is getting that home medication list, getting it accurate. And then from there, that can either be a technician, a pharmacy intern, or a pharmacist that's collecting that home medication list. But from there, it goes on to the provider to make the decisions. Do I need to continue this while they're in the hospital? Do I not? And how do we want to move forward with that? And pharmacists are ingrained throughout that entire process and that direct patient care and making sure that they're kind of elbow to elbow with the providers throughout the patient stay to be there for recommendations.
So it's a total collaborative effort then?
Yes.
Yeah.
And it continues to be more and more each year. The collaboration needed in healthcare just continues to expand.
Okay, we're going to take a break. Come right back. 721-1290 is our number. You can also, like Katie, make your question on our Facebook page. We're talking with Jason Nickisch, who is the Pharmacy Clinical Manager with Providence Health and Services. Back with more of Health Talk in a moment. And we're back on Health Talk, sponsored by Providence Health and Services, Western Montana. Jason Nickisch joining us here in studio, Pharmacy Clinical Manager. One quick question. Just talk about safety to make sure that a patient doesn't experience negative effects of, especially long-term after they leave. How do you make sure that everybody's safe and sound when they leave the hospital?
Well, I think safety starts from the very beginning of their hospital stay. So like I said, making sure that we have an accurate list of their medications, we know what the patients are on, is step one. And from throughout their hospital stay, making sure that we're doing our due diligence to have everything packaged and prepared appropriately at the highest level. And then as they leave, we want to make sure that they're getting that education as they're leaving the hospital and trying to bridge that gap between the hospital and their community pharmacy or their provider out in the community to make sure that that information gets communicated effectively across that spectrum so that everybody's informed of where they're at, what was going on while they were in the hospital, and what that means as they get discharged and are back in their home setting.
Take me back to when you were a pharmacy student, and you're back in what, 2002?
I graduated 2002.
Okay, so maybe 2001 you came in and you interned. So what was it like for you? Tell me about your experience at Providence.
I think as a student, it's just kind of an open world. You're trying to figure out where's my place going to be as I exit pharmacy school.
A lot of folks don't realize that there are specialties within pharmacy, right?
Right, absolutely.
Okay. All right.
And that was my interest through pharmacy school, was pediatric medicine, and we don't have a lot of that in Montana, and especially 10 plus years ago, we didn't have a lot of that. And so for me, I needed to actually go and do that additional experience. As I said, went to Denver Children's and did a year of postgraduate training to get that experience. But that's what that schooling does, is it exposes you to different areas of specialty practice, lets you kind of get a feel for that, whether that's something that you could do long term or not. And that, I think that's where the education at UM really comes into play and provides students with that guidance.
All right. Well, Jason, we have like about a minute left in the program. So if you wouldn't mind giving us some information about, if folks want to find out more about the pharmacy program, first of all, and about Broadway Pharmacy and the in-house pharmacy there at St. Patrick Hospital, what do they do? How can they find out more?
Well, I think the easiest way is to go through the website. So the Providence St. Patrick Hospital website is kind of the first touch point. But if somebody's truly interested in finding more, especially about the inpatient pharmacy, they definitely can contact me through email, and I'm happy to answer questions on that front, and just to make sure that people are kind of aware that we're there, that we exist. Mm-hmm. But if anybody's looking for what that means from an educational opportunity, I'm happy to talk to them about that as well.
Just a couple of quick words. What fires you up about going to work in the morning? What is it that you just love?
I just love the practice of pharmacy. I love getting in and assuring that patients are receiving the highest level of care they possibly can. And for me in pharmacy, that means that their medication regimens are optimized at the highest level and that we can take care of that for them.
Jason, it's been a pleasure meeting you. Thank you.
Thank you.
And that's going to do it for Health Talk. We'll do it again next week. Brought to you by Providence Health and Services, Western Montana.